Hey, Nurs, little tick.
Hey, Nurse J. Wow, you got my patient?
Yes, I do.
Alright, so this is Mr. Babylon. He's in room 12. You had him before?
Yeah.
Alright, okay, so he's a 59-year-old male with increasing shortness of breath. He's been sleeping the whole night for me, but he's been arousable. And he's learning-oriented. He's still on 2 liters nasal cannula. He's been sounding in the low 90s for me, but I think that's okay. He's still got his IV sites in. He's got a left IJ right now. It's currently running normal saline TKO. And we put in another 22 gauge in his right forearm and his half right now. Right now I think his sister's in. I think her name is Claude. Okay. Any questions? No, I'm good. Alright, I'll be here. Okay.
God, I really hope we don't have to change another diaper today.
I know, we did that all last time.
Excuse me, are you Nurse J-Well?
Yes, I am.
Oh, great, we were looking for you. We're Cal State students, and we're going to be assisting you today. I'm C-Man.
And I'm Debs.
Okay, nice to meet you.
Good to meet you.
What are you guys capable of doing?
Well, we're pretty much going to be doing what you do, head-to-toe assessments, charting, medication administration.
And if there's any skills you need, just go ahead and let us do it with some supervision.
Okay, well, let's go do this ourselves.
Sounds good.
Who is it?
Hey, Mr. Babylon. Hey, my name is Nurse Jenwell, and I have two nursing students here who are going to be taking care of you. Okay?
Hi, I'm C-Man.
Hello, Steven.
No, not C-Man, C-Man.
Oh,
And I'm Debs.
hello.
Okay. And are you his sister?
Yes, I'm his older sister.
Oh, Cloud. Nice to meet you. We're going to go ahead and do an assessment. Okay, guys?
Sounds good.
Okay. Is that okay? They do an assessment on you?
Yes.
Okay. So, on his general appearance, what do you guys see?
Well, definitely when we came in the room, there's a lot of shortness of breath going on. It seems like when he speaks, he has a lot of trouble. I see some restlessness going on, and he looks like a lot of fatigue. And there's some cyanosis, especially in the periphery here.
Yeah, okay. What about his heart and lung sounds? You can need your stethoscope for that. So,
yeah, sure. I got that. Yeah, he definitely has a lot of dyspnea, and I'm going to take a listen to this.
yeah, go for it.
Tick, 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 tick. Well, he has a lot of crackles in his lower lobes. He has a tachycardia. Heart rate is 139, and his heart rate is irregular.
Okay.
Yeah.
All right.
Have you had any cough?
Yes.
Yeah. Well, his cough is productive and it's pink and frothy.
Oh, okay. What about his skin? What do you think about his skin?
Well, the one thing that I really noticed was all this edema that's going on here. It seems to be really swollen, especially in the lower extremities. His hands are humongous, and if I push my thumb in, look at that. Pitting edema.
Wow, that's really bad.
Okay. All right, well, let's go ahead and do some interventions, okay?
Sounds good.
So the first thing we're going to check CVP, okay? Do you guys want to do that?
Yeah, I could go ahead and take care of that for you.
Excuse me, what's CVP?
Oh, well, you want to explain?
Sure, let me try to do that. All right, so basically what's going on, CVP is going to be the central venous pressure, and that's going to measure the fluid balance within his body. And what basically I'm going to be doing is I'm going to be taking this apparatus right here, and I'm going to be zeroing it out, right?
Yeah.
So I'm going to close it off to the patient, open it to atmospheric pressure, and that's going to take an updated reading of his current fluid volume. And when I do that right now, it looks like it's reading at 20. We normally want around 6, but because he has a lot of fluid retention, it's kind of expected that it's high, but we're working on getting that down right now.
He's not gonna die, right?
No, we're doing our best to get
We're
that
taking
down.
good care of him.
Die?
No, not today, sir.
All right, so next we're going to check vital signs. You guys want to do that?
Yeah, sure. We're gonna go ahead and take your blood pressure, okay?
I'll do your temperature here.
So his blood pressure is 108/52. That's okay. His heart rate is 140. It's irregular. That's tachycardia. Pretty much the heart is trying to make up for his decreased cardiac output. His respirations are 30, and they're very, very labored. The lungs are also trying to make up for his increased heart rate. His temperature is 99. That's okay. Pretty much the body's trying to like compensate and balance itself. I'll take care of itself right now.
Yeah, good job. All right, so next we're going to go ahead and put some pillows underneath him. We're going to elevate him a bit.
Sounds good. We're going to need your help here, Mr. Babylon.
Okay. And basically we
There you
just
go.
do this so he can breathe better. That way his chest, his
So
lungs
much
can
better.
expand.
Thank you.
Okay, good. And we're also going to turn him to the side. We left the pillow. So be careful. And this is just to prevent skin breakdown because since he has a lot of edema, he's at increased risk of getting ulcers and stuff like that.
Oh,
Okay, so we're gonna chair him.
yeah, we don't want
Okay.
skin breakdown.
There you go. You feel better?
Yes, ma'am.
Okay, so next we're gonna check INOs. Why do you think we do that in this patient?
Well, it's important to keep strict INOs so that we have an idea of the patient's fluid balance. Keep notes of everything he's taking and everything he's putting out.
Good, all right. And the last thing we're gonna do, and then we're gonna leave you alone, is we're gonna check his oxygen. Okay, make sure to always follow doctor's orders for that. And he seems to be getting 2 liters of oxygen through the nasal cannula.
Yes.
And that's good because he needs more oxygen because since he has a lot of fluid in his lungs, then he needs that extra oxygen to promote that gas exchange.
And also because his SpO2 is at 92% and the cyanosis, right?
Yep, exactly. Okay, so I think
Good morning.
Uh,
I'm your doctor today. Dr. House, how are you?
Doctor!
Are you
I'm
his
so
sister?
scared, doctor. I feel like I'm going to drown.
Okay. Can you tell me what symptoms you came in with when you came in?
Oh, doctor, shortness of breath. I used to walk a mile every day, you know?
Uh-huh.
I used to go to the gym every day. I used to be buff, man. But now I feel so fat with all this fluid buildup. I can't do anything anymore. Can you take it off,
Yeah, we'll certainly
please?
try. Are you his sister?
Yes.
Can you tell me his past medical histories?
Well, in 2007, my brother got stroke and he got cabbage. And then he also smokes 1 pack of cigarette per day. And he's been smoking for 30 years. And I keep telling him, don't smoke.
Oh, shut up.
He doesn't listen to me. And also, his wife keeps complaining to me because his feet is so fat. And she can't look at it because it's so ugly. And he thinks,
Is he taking any medications at home?
I know he's taking aspirin and Lipitor.
Okay, Mr. Bigelow. Basically, what we're seeing from the tests and from the assessments, you have congestive heart failure. So basically, your heart isn't working as well as it used to. So it's building up fluid around your heart, around your lungs, in your body. That's why it's hard to breathe, okay?
Can you take it off?
Well, we'll certainly try. We're going to give you some medications, okay? First, I'll give you Vasotec. It's an ACE inhibitor. It's going to decrease the workload of your heart, okay? We're going to give you some low pressure to decrease your blood pressure. We're going to give you digoxin to increase the contractility of your heart so your heart can pump better, okay? We're going to give you some phytocontin. It's going to relax your airways. It's going to help you breathe. And we're going to give you some Lasix. It'll decrease the excess amount of water in you, okay?
Okay, thank you, doc.
And nurse, let's keep an eye on the digoxin levels. Let's keep the O2 about 93%. And we'll put them on a low sodium diet.
Oh no, is that mean I can't eat any more noodle?
Yeah. Brown rice.
We love noodle. We can't live without noodles.
Brown rice.
Oh, what do you know, Dr. House? You're not Asian.
I'm gonna go ahead and fax this order, okay?
Okay, all right.
Hey, hi guys.
Hi, Professor
Professor
Antoine.
Antoine, how you doing?
I'm good. Simon and Debs.
Yes.
So, can you tell me about your patient?
Yeah, our patient, Mr. Bagel, he came in with shortness of breath and had a lot of edema. He can barely speak.
Wow. Well, I was checking his chart and I noticed that his chest X-ray said he had cardiomegaly, so it's hardly huge. And I also checked his EKG. He has AFib with ventricular rate of 140.
It's really fast.
Wow. Well, I'm going to talk to you guys about the patho of CHF. So basically, your patient must have had a heart damage from various risk factors like smoking. Does he smoke?
Like a chimney.
Oh,
There's
wow.
30 years, 1 time per day.
And then his diet too. Does he have like a high sodium diet and anything like that?
He lives for the noodles.
Oh wow. Oh, well, that explains why he has a heart damage. Well, with the heart damage, that affected his ventricles, mostly the left ventricle, because that's the main pump for the body, right? So the left ventricle is affected and it's damaged, and so that decreases the blood volume that leaves the heart, right? And that's why you have decreased cardiac output. Now, when you guys were taking care of your patient, do you guys remember if you had any nursing diagnosis?
Well, the one that came to my attention first was his breathing, and I had to go with an effective breathing pattern. It was shortness of breath, it was labored, so that was really evident.
Oh, okay. What about you
I'll
guys?
say decreased cardiac output.
Yeah, good. Well, with the decreased cardiac output, as you guys can tell, so the body tries to compensate by increasing the heart rate. And so when it increases the heart rate, basically it has like a